This video is for you if you have had a miscarriage and you're wondering why. Hello, my name is Dr. Confidence Oblumade and I make content regarding women's health and well-being. In this video, we are going to be looking at 7 reasons why a woman can have a miscarriage. Miscarriages are very common, but most women don't talk about them because of feelings of guilt and disappointment. But miscarriages need to be talked about because you need all the support you can get through this period of grieving and wondering and asking and seeking answers. And it's also important to know why a miscarriage happened, or at least possible reasons for it, so that it doesn't happen again. First of all, I want to reassure you that having one miscarriage does not automatically mean that your next pregnancy is going to end in a miscarriage. So long as the possible reason why the first one happened is due to a preventable reason. So now we are going to be going into these reasons why a miscarriage can happen. So the first and most common reason why a miscarriage happening in the first trimester, that is the first 3 months of pregnancy, why a miscarriage can happen is due to chromosomal factors. What do I mean by chromosomal factors? When the egg and the sperm cell mate, they come together, fertilize, and then become the embryo. But in that formation taking place, the genetic component down to the part we call the chromosomes, there can be a mix-up. I don't want to bore you with all the medical terminologies, but there can be a mix-up in that formation such that if that pregnancy continues, that baby is not compatible with life. So the body finds a way to end that process so that that mismatch doesn't continue. It's just like in a factory, in a production line where products are being made, and then there are some products that don't align or develop a fault in the production line, and then those have to be discarded. That is akin to what happened in this scenario. And these chromosomal factors can be due to the quality of the egg or quality of the sperm cell that is involved in that process of fertilization. And we underestimate the importance of the oocyte quality, that is the egg quality. But then we find that in assisted reproduction, we see how important and how significant egg quality and gamete quality plays in the process of fertilization. So this is important. Going forward, another reason responsible for miscarriages is the presence of chronic illnesses. Chronic illnesses like diabetes, hypertension, thyroid diseases. If a diabetic has poorly controlled diabetes, has poorly controlled glucose, if a diabetic has poorly controlled glucose, this can account for miscarriages, or poorly controlled hypertension, or if the thyroid gland, which we all have in our necks, is producing too much thyroid hormones or too little thyroid hormones, this can affect pregnancy. So if you have had miscarriage and you had any of these factors, which your doctor may be able to identify and tell you, it's important that these are controlled before the next pregnancy is attempted to increase the chances of a successful pregnancy, even leading up to a live birth. Number 3 is issues of hormonal support. We have there's a condition called the luteal phase defect. In the menstrual cycle, in the beginning, in the first half, the innermost lining of the womb, called the endometrium, it starts to grow, growing so that if pregnancy occurs, it can be supported. In the second half of the cycle, those glands in that growing endometrium, which, like we said, is the innermost part of the womb, they start to secrete, they start to engorge, getting ready to accept and establish a pregnancy. That process is supported by a hormone, an important hormone called progesterone. In some women, that progesterone level drops or is not sufficient to support that pregnancy up until the time the placenta takes over supporting the pregnancy. So when that progesterone level drops, is not quite enough, there is a defect, then progesterone drop. So this is why when this happens, we support the next pregnancy. We give hormonal support, we give progesterone, supplemental progesterone to support the pregnancy. So going forward, another cause is a condition we call, or an autoimmune condition called antiphospholipid syndrome. What really happens is that the immune system starts to fight proteins in a woman's body. Normally, the immune system should fight extraneous things, bacteria, viruses, and the likes. But when the body's immune system starts to fight proteins in the body, and then they affect the veins, the arteries, and inadvertently they will affect that placenta formation and then the establishment of that pregnancy. So antiphospholipid syndrome can be a cause, which, especially when pregnancy is recurrent, it has happened and happened again, then it is worth searching for that cause and um, taking care of it, treating, um, instituting treatment so that it doesn't happen again. Then environmental factors. Environmental factors such as exposure to metals like lead, metals like mercury. These can be very detrimental to a developing fetus. And in fact, it may even be lead or mercury, lead that a woman has been exposed to in the past. And then that has an effect on her current pregnancy. However, with current regulations and all, this is not very common. What other factor can be responsible for pregnancy? Now we're going to look at another one, smoking. Smoking cigarettes, tobacco, cocaine, marijuana, these are detrimental to a developing fetus. So these are habits that ought to be dropped so that a developing fetus is not denied the chance of survival. And these are really very preventable to ensure a healthy pregnancy and a live baby at the end that doesn't have an anomaly. Also, another factor we have to look at is obesity. Obesity can cause an internal environment in the body where there's chronic inflammation. And with chronic inflammation, there are some substances we call cytokines that can be released, and then these are not friendly to a developing fetus. So this can cause that pregnancy to fail. So it is worth imbibing some is what's imbibing the dietary and lifestyle change to lose weight over time, so that the chances of having um, a life, a successful pregnancy and live birth in the next pregnancy can be achieved.